Hello and welcome back to my channel.
In today's lecture, we are going to study about the brachial plexus in the most easiest way ever. To start with the brachial plexus, we should divide it into roots, trunks, divisions, cords, and the terminal nerves. And to remember this, you should take a paper and pencil and draw it with me. And trust me, you will never forget that later on. First of all, consider your five fingers as the roots of the brachial plexus that starts from C5, C6, C7, C8, and T1. The upper two fingers join together to form the superior trunk. The middle finger make the middle trunk, while the lower two fingers make the lower trunk. Now, you should appreciate a perfect pattern in the brachial plexus. What is that? There is a pattern of merging and division in the brachial plexus. Roots join together to form the trunk, then trunk divides in the divisions, then the divisions join together to form the cord, and the cords again divides into the terminal nerves. Now, let's start. First of all, the C5 and C6 are joining together to form the superior trunk. C7 forms the middle trunk, while the C8 and T1 forms the inferior trunk. If we are clear till now, then we'll move forward. Then each trunk gives two divisions, the anterior one and the posterior one. Anterior, posterior, anterior, and posterior. Must row with me. Now, the posterior divisions of all the three trunks will join together to form the posterior cord. Posterior divisions to posterior cords. Now, the anterior division of the C8 will continue as the medial cord, while the remaining two anterior divisions, the superior trunk and one of the middle trunk will join together to form the lateral cord. Now you have three cords: lateral cord, posterior cord, and the medial cord. Now the most complex part of the brachial plexus, which is the terminal nerves or the branches of the brachial plexus. In my student life, I recall them by comparing them. First of all, you should remember there is a figure of 3, 5, 5. And what is this? This means the lateral cord has 3 branches. The posterior cord has 5 branches. 1, 2, 3, 4, and then the 5. And the medial cord also has 1, 2, 3, 4, and the 5. I am not naming them right now because we'll name them later on. Before moving forward, we'll move towards the roots again. In the roots, there are two nerves. You should draw with me, one from the C5 and one from the T1. C5 gives the nerve contribution to the phrenic nerve, that is a nerve of diaphragm, and the T1, because T1 related to the thoracic cavity, So it will provide the nerve to the first intercostal nerve. Now, moving forward, in the roots, we have another two nerves, 1 and 2. One nerve is from the C5, while the other one has three contributions, C5, C6, and C7. As it's a nerve running down, so we named it as long thoracic nerve. I am not naming this nerve right now. Later on, I'll tell you why I haven't named it earlier. Now, in the area of the superior trunk, there are further two nerves. Just draw it as it is without naming them. Now, I am writing here something. There are three nerves related to scapula, which are dorsal scapular nerve, suprascapular nerve, and subscapular nerve. Subscapular nerves are also of two types, superior and inferior. Now, we'll name them. From the root, the leftover nerve is the dorsal scapular nerve. From the trunk, it's the suprascapular nerve. And from the posterior cord, they are superior subscapular nerve and the inferior subscapular nerve. This is also a nerve to the muscle to the scapula. That is nerve to subscapularis. Now, as we have completed this, we will erase this. Now, moving towards the deviance, as deviance has no nerves, now we'll move towards the cords. In the cord, the major two nerves that supply the arm and the forearm are the musculocutaneous nerve and the lateral part of the median nerve. In the posterior cord, the two major nerves are the axillary nerve and the radial nerve. While in the medial cord, they are ulnar nerve and the medial part of the median nerve. Both the lateral and the medial parts merge together to form the median nerve. I'm not naming the other branches of the cords because the major nerves are musculocutaneous, median, axillary, radial, and the ulnar nerve. It's easy to remember these nerves by this way. Now the leftover nerves. As we have only left with one nerve here. So what was that? It's lateral pectoral nerve. From the lateral cord, it's the lateral pectoral nerve. And in comparison to the lateral pectoral nerve, there must be a medial pectoral nerve. That is the nerve from the medial cord. There are only two left branches of the medial cord, that are medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm. You are done with the lateral cord and the medial cord. Now, by doing the scapular nerves, you are also done with the posterior cord. The only nerve left is the thoracodorsal nerve. If you have drawn that brachial plexus with me, now let's revise the nerves. The terminal nerves of the lateral cord, which are three in number, are the lateral pectoral nerve, musculocutaneous nerve, and the median nerve. While in the posterior course, these are axillary nerve, radial nerve, inferior scapular subscapular nerve, superior subscapular nerve, and the thoracodorsal nerve. In the medial core, they are medial pectoral nerve, medial brachial cutaneous nerve or the medial cutaneous nerve of the arm, and medial antebrachial cutaneous nerve or the medial cutaneous nerve of the forearm, and the ulnar nerve and the median nerve. In the root, there are two branches from the C5 that are contribution to the phrenic nerve and the dorsal scapular nerve. While in the T1, there are first intercostal nerve and the one long nerve having three roots C5, C6, C7 as the long thoracic nerve. In the trunk, the two branches or the two nerves are the suprascapular nerve and the nerve to the subscapularis. I hope this lecture will help you out in remembering the brachial plexus.
Thank you for watching. Kindly like, subscribe, and share for more videos.